Welcome to the American Nephrology Nurses Association's 50th Anniversary Podcast Series. In this commemorative series, past presidents and other leaders of the American Nephrology Nurses Association will provide a rich history of the association itself and of nephrology nursing as a specialty nursing profession. The American Nephrology Nurses Association's 50th Anniversary Podcast Series is brought to you by the Nephrology Nursing Journal, the official journal of the American Nephrology Nurses Association. We are honored to present this episode, and we hope you enjoy these invaluable and enlightening nephrology nursing recollections.
Hi, my name is Tamara Kear. I am ANNA's current national president. Today it is my honor to interview Dr. Beth Ulrich, who was the president of ANNA from 1984 to 1985, and she is currently the editor of the Nephrology Nursing Journal. Beth, I want to thank you for taking time today to talk to us about the history of ANNA, nephrology nursing, and the Nephrology Nursing Journal. So my first question to you is, I'm curious to learn about how and when you became a nephrology nurse, and also, what was your first nephrology nursing position?
Well, I'd love to tell you a story about being called by the kidneys, but that's just not what happened. In 1972, a year after I graduated from nursing school, I had heard about a position in the hemodialysis unit of a large Army hospital where my husband was doing his internal medicine rotation or fellowship. But I have to admit, it was really the work schedule, the hours, the all-day shifts, most weekends and holidays off, that really got me to the job. I didn't know a whole lot about hemodialysis, knew a little bit about kidneys from nursing school. But I did an independent study in my senior year of nursing school where I followed a patient who was on dialysis and who had a kidney transplant, and that kind of intrigued me. My first position, I was hired to open a home hemodialysis program, and they had their first patient, they told me, who was scheduled to begin training in 6 weeks. So it was really the ultimate see one, do one, teach one, and I had to write the home training manual at the same time. And then we also started a self-care option for our patients who had to be dialyzed in-center. My next position closely following that, though, was I worked as a nurse for the Cordis Corporation. So while Cordis, while working on a method to desalinate seawater, had developed a new membrane that could be used in dialyzers to make them more stable and more efficient with the membrane and give us a larger surface area. And ultimately, they also made hemodialysis equipment. I was one of the first corporate nurses in the country. My job was to go to dialysis units around the country and teach physicians and nurses and technicians how to perform hemodialysis using these new hollow fiber dialyzers. And I also got to work with the engineers on improving dialysis procedures and equipment. One of the absolute scariest things I had to do, though, was I had to write the package insert to tell people how to use the hollow fiber dialyzer. I must have reread that thing 100 times before I was willing to send it out. But I learned so much in that job, visiting different dialysis units every week, getting to see how dialysis was done across the country. It was a real learning experience. And in those years, nephrology and me both were in our professional infancy, and we kind of grew together a bit. And so I also joined ANNA, which was AANNT at the time, very early in my career, and the world got wider, you know. I met other nephrology nurses. I learned a lot. And then Caroline Counts called and asked me to run for Southeast Regional Secretary. Little did I know that would lead to one of the best experiences of my life, being president of ANNA. So that's how it started.
That's such an interesting story and pathway in your pioneering years in nephrology nursing and in care of patients with chronic kidney disease. So now I'm wondering if you can build off of that story and tell us what it was like to be a nephrology nurse, to work in nephrology, and to be in those early years of ANNA as president in 1984 to 1985.
You know, it was such an exciting time to be in nephrology. We were developing new technologies. We were learning as we went. We were making a lot of progress on how we provided dialysis and transplantation. And as a result of that, we were designing and growing the specialty of nephrology and nephrology nursing. There were a lot of big challenges, and there were a lot of big opportunities. So an example, one of the biggest challenges was staffing. In some of the outpatient hemodialysis centers, staffing was really getting cut to scary levels. And ANNA had to raise its voice and make sure nurses were heard on the patient safety and the nurse burnout issues that the short staffing was causing. In other places, creativity just abounded. So, for example, when the new diagnostic-related group payment system, DRGs, was implemented by Medicare, that really challenged our ability to decrease cost while we maintained quality. In the unit I was working in the kidney center I was working in, we had to drastically cut the cost and the length of stay for patients who were receiving kidney transplant. So these were patients that prior to the DRGs had spent several weeks in the hospital recovering, getting their meds adjusted, which was a big deal because we were one of the 10 centers nationwide conducting the clinical trials on cyclosporin. Now they need to be discharged in about a week to meet the new payment system and the length of stay as well as the cost. So I remember working with our transplant team to develop a program where a week after transplant we could discharge some of our patients who had a family member or a support person to a hotel that was near the hospital, and we would pay for a week for them at the hotel. As it happened, the hotel was also next to Astroworld, a large amusement park, so it didn't hurt the patient's desire to want to be discharged there. They would stay at the hotel for a week, and during that week they would come to the outpatient clinic every day so we could check their cyclosporin levels, and they got to see one of our transplant nurses. As it turned out, the strategies cut costs. Patients got better a lot faster outside of the hospital than they did when they were inside the hospital for such a long period of time. So it was a big win-win for everybody. And as I was preparing for this interview, I had gone back and looked at the President's messages that I wrote, and the topics, I think, kind of tell a story of the time. They were topics like responding to the membership mandate to return the organization to a registered nurse-only organization, collaboration and competition, being proud to be a nurse, challenges and creativity brought on by these new regulations I talked about, certainly the scary staffing, and the professional responsibility of registered nurses to contribute to the improvement of our specialty and to advocate for their patients at such a critical time. So that pretty much sums up 84 and 85.
It's so interesting because here we are in 2019, almost 2020, and many of the issues, if not all of the issues in some fashion that you just described, are issues that have circled back around again as we look at the healthcare environment, as we look at nursing and nephrology nursing, and as we look at the Advancing American Kidney Health Initiative. So it's fascinating how things come full circle and we make progress in some areas, and in other areas we continue to push forward. So I want to ask you now, when you think about the presidency in the mid-1980s, what was the greatest advancement for nephrology nursing at that time?
So when I came into the presidency, we had just returned our roots as a registered nurse organization. In fact, my first act as president was to drop the banner to display our new name, the American Nephrology Nurses Association. We continue to work with other nephrology specialties to promote collaboration in nephrology associations and their members. In fact, ANNA organized and hosted the first assembly of nephrology organizations. But when we had to take positions on issues, we were laser-focused on patients and the role and expertise of registered nurses. We began implementing a long-range plan for the association with the goal of protecting the future of quality care, especially in an era where money was short and a lot of demands were being made on the system. We thought that protecting the future of quality care was the most important thing we could do. And we significantly contributed to crafting the passage of organ procurement legislation in the country. We also promoted nephrology nursing research, and we grew our subspecialties through the special interest groups, which are now called the Specialty Practice Networks.
Thank you for sharing the early years of ANNA as a volunteer association for nurses. So when you think about your career in ANNA as a volunteer association, what impact has ANNA's volunteer roles had on you and your career?
So representing a specialty like nephrology nursing and trying to ensure the quality of care nationwide for patients with kidney disease was a big honor, but it was also a huge responsibility, far bigger than anything I had ever done in my career. So one of the things it did was it stretched all of my existing expertise, and it made me learn a lot of new skills. For example, as president of ANA, I had to develop communication and leadership skills at a whole new level. Now, I'm sure you've experienced this, Tammy. It's one thing to talk to local nurse and physician colleagues. It's a whole other thing to talk on the national stage to influence people like senators and members of Congress and the Medicare administrators. And the other thing about ANA, which personally is very important to me, is that ANA has been responsible for so many friendships in my life, many lasting 30-plus years. I served with outstanding boards of directors members, and I got to know so many nephrology nurses. And I'd really be remiss if I didn't tell you about one of my dear friends and fellow past presidents, Janelle Parker, who I met when we served on the board of directors in 1982. I was the Southeast Region Vice President when we had regions at ANA, and Janelle was the North Central Vice President. And we had one of those instant connections that you just treasure forever in your life. When I served as president of ANA, Janelle served as treasurer. She was also president of ANA from 1986 to 1987. But she passed away in 2003 following injuries from an automobile accident. Her legacy, however, to ANA and nephrology nursing continues today. And I'd like to tell you just a little bit about it. During Janelle's presidency, the scope of practice for nephrology nursing and the first edition of the core curriculum for nephrology nursing were published. The first clinical concerns nephrology meetings were held, and the Renal Coalition was formed. You know, like most association presidents, Janelle had a passion that she began work on long before her presidency and continued to work on for the rest of her life. Janelle's passion was competency of nephrology nurses. Under her guidance and her leadership and her prodding and, frankly, her dogged determination, the Nephrology Nursing Certification Board NNCB was incorporated, and the Nephrology Nursing Certification Exam was developed and implemented, with the first test being done in 1987. Janelle served as the charter president of NNCB and then as its first-time full-time executive director. She went on to establish the American Board of Nursing Specialties and was its first president. In 1988, she served as editor for ANA's first contemporary nephrology nursing textbook. Janelle's contributions to patient advocacy was so substantial that she was made an honorary board member of the Georgia Association of Kidney Patients, and she was a mentor to countless nephrology nurses and technicians.
Thank you for sharing that information on Janelle, particularly because, unfortunately, she can't share that history of her career as well. You mentioned the word mentor, and I would be remiss if I didn't mention what a mentor you've been to me and to a number of nephrology nurses over years and decades who move our profession and our association forward. I have two questions that are going to focus on your career that you've had since you were serving your term as ANA president. Since that time, what have you been doing? What have you been working on? And what has your career looked like, Beth?
Well, it's sure been interesting, and not one I would have predicted, by the way. I have such a wonderful career, and I've had so many great opportunities. Honestly, it's been a dream. So I got my first management job as a director of a hemodialysis unit, and I was fortunate enough to have a boss who was willing to teach me how to be a manager, which I learned later was not always the way nurses came into management, but I was very lucky. And then as I did that, I started to understand how important education was, both for having a successful career and being a better nurse. And so I went back and got my master's, and then I had the opportunity to get my doctorate in allied health administration education. And I had the opportunity to be the administrator of a large comprehensive kidney institute, to be involved in major research that advanced the care of patients with kidney disease. But at some point in my career, I moved into hospital administration, a broader base. And I was a chief nursing officer and later a chief operating officer, and I held executive positions in large healthcare organizations and healthcare systems. Had the opportunity to help hospitals start residency programs for new graduate RNs and do national research that's improved the health of nurse work environments throughout the country. I've written a few books. The first book was one of the first nephrology nursing textbooks. I wrote a book on management and leadership according to Florence Nightingale. And more recently, my work has been on a book on mastering precepting and a book on using simulation in healthcare. Currently, I'm a professor at the School of Nursing at the University of Texas Health Science Center at Houston, and I teach in a nurse executive D&P program that lets me combine those experiences I've gotten as an executive along with my love for teaching and helping nurses advance their careers. And I'm also very proud to serve as the editor of the Nephrology Nursing Journal, a position I've held for the last 17 years. So it's been a really full and a really rewarding career, and it's been a wonderful adventure.
That certainly is a full and rich career that you've had. And now that you've mentioned your role as editor of the Nephrology Nursing Journal, let's move our question and focus to that particular topic. I'm interested in learning, as I'm sure our listeners on this podcast are interested in learning, what development and advancements have occurred within the journal, within nephrology nursing, and also in your role as editor when you think about this position.
So it might sound like a contradiction, but we've seen our authors both become more sophisticated in what they write about and also gain an understanding that sometimes basic information can change practice the quickest. We've moved from care-based on anecdotal information and ad hoc experience to an evidence-based practice that's driven by knowledge and expertise and research of nephrology nurses. We've certainly seen that in the articles we receive in the journal. One of the things I'm most proud of, though, with the journal is our continued effort to support novice writers through our writing workshops and coaching provided by our editorial board members. And most importantly, the journal has had a positive impact on quality of care for our patients. We have actually seen evidence that one journal article can change nephrology nursing practice around the world, and that's just spectacular for me.
It's incredibly powerful. It's definitely powerful. When we think about the future of the Nephrology Nursing Journal, what do you envision for the journal in the future?
We're going to continue trying out new things to meet the needs of our readers. We always try new things. I have a great editorial board, and thank you for your service on that board before you became president. So the board comes together several times, but at least once a year, for us to really look at what do we need to do to update the journal? What do we need to change? And so one of the examples is the digital edition of the Nephrology Nursing Journal that we started several years ago. And another example would be doing these podcasts to celebrate ANA's 50th anniversary. And so we're taking the journal online in a couple of different ways, and now people, for example, can hear the voices and the words of past presidents of ANNA to get a better idea of what nephrology nursing has looked like across these 50 years. But, ultimately our goal is always to improve the quality of patient care and what we do in the journal.
And it's certainly been my pleasure to serve on the editorial board of such a fine journal. So in closing, I have one final question for you before we end the interview. What short message or thought regarding nephrology nursing, either current, past, or present, would you like to share with our listening audience? And then you have the mic for any other thoughts. Please feel free to share those as well and questions and information that we may not have covered in this podcast.
I think we're in an era of major change in healthcare and nephrology, and maybe as big a change as we've seen since the early days of nephrology. There's a lot of new disruptors in the healthcare system as a whole. For example, you've got major retailers like CVS and Walmart who are providing more healthcare services and at the same time improving access to care. And I mean dentists and social workers and nurse practitioners and a whole array of healthcare workers being provided by these associations on site in their retail spaces. Businesses like Microsoft and Amazon are using really innovative technology to focus on improving the health of their employees. For example, Amazon's using a lot of telehealth. The scope of practice for nurse practitioners is expanding in many states, and we're quickly moving towards a doctorate in nursing practice being an expectation for advanced practice nurses. In nephrology, we're making major technological advances in renal replacement therapies. We're improving access creation, and we're getting a whole heck of a lot closer to that wearable kidney we've been trying to develop over the last, I don't know how many years. And now we have a new national focus on caring for patients with chronic kidney disease. I do find it really interesting that part of the focus is increasing the number of patients on home dialysis. It does seem like we've come full circle because in the early days of nephrology, we did a lot of home dialysis, often because it was less expensive for patients and we didn't have a lot of nephrology nurses. We moved away from it as payment systems encouraged in-center care. But in my experience, patients had a better quality of life when they needed a home dialysis or self-care in-center. So I'm pretty happy about the potential of making that treatment more available. But I know that change, like the others I've mentioned, is going to require new systems and new nursing knowledge and skills. So lots of change for our patients and for nephrology nurses now and in our future. But it's nothing we can't handle, and it's sure nothing we can't excel at. You asked me earlier what my message to nephrology nurses would be. I would say this. As nephrology nurses, we have the knowledge and expertise to lead the next revolution of care for patients with kidney disease. But it's up to all of us, each of us, to take the initiative. We've done it in the past, and I know we can do it again.
Dr. Beth Ulrich, thank you very much for your time, for answering the questions, providing the history, the insights, and a glance to what we potentially may see in the future. Thank you very much. It's been my pleasure.
Thank you, Tammy.
The American Nephrology Nurses Association's 50th Anniversary podcast series is brought to you by the Nephrology Nursing Journal, the official journal of the American Nephrology Nurses Association. This series is owned and produced by the American Nephrology Nurses Association. All rights reserved. No portion of this podcast may be used without written permission. For archived episodes of this podcast and to learn more about the American Nephrology Nurses Association, visit the association's website at annanurse.org. You can also subscribe to this podcast on iTunes, Google Play Music, Spotify, Stitcher, TuneIn Radio, our hosting site Spreaker, and other various podcast delivery services.